Salams from the People's Dispatch studios here in New Delhi. I'm Siddhant Ani and you're watching Daily Debrief. On the show today, we get an update on the unfolding political crisis in Peru from our reporter Zoe Alexandra on the ground in Lima. And we look at China's COVID-19 surge and what the wave might mean for countries around the world. Supporters of Peru's democratically elected President Pedro Castillo continue to take to the streets in the country's capital Lima and elsewhere in the country, demanding his release and return to office after he was deposed by the country's right-wing congressional majority and arrested on charges of rebellion and conspiracy. Castillo had tried to dissolve Congress temporarily and rule by decree in a hope to re-establish the rule of law and democracy in the country. This was on the 7th of December. The move was opposed by Congress, Castillo arrested, and his deputy, Dina Boluarte, installed to replace him. Zoe Alexandra has been on the ground in Lima for a couple of days and is reporting for People's Dispatch. I spoke to her earlier for Daily Debrief via video conference.
Zoe, good to see you. You've been in Peru for a couple of days now. How are you doing? What's the update?
Well, yeah, I've been on the ground since Saturday morning. I've been going to different protests, going to different sites within Lima of people who are protesting the coup against Pedro Castillo. It's quite tense on the ground, to be honest. Every day there are reports coming in of different acts of violent repression, both in the city of Lima, but also and especially outside the city in the provinces where there have been extensive road blockades, where different airports have been blocked off. There's a lot of indignation, a lot of anger against this government, this coup government of Dina Boluarte, for ordering the repression of these protests, which has to date cost the life of at least 27 people, most of these young people. In one day, there were people aged 15 to 18 killed, about 7 of them. So there's a lot of anger really across the country because of this repression, because of the coup against Pedro Castillo, and of course the reaction of the mainstream media, which has been to criminalize the protesters, to say that they're terrorists, to say that they're criminals. This has provoked a lot of anger from the people who are on the streets really demanding a return to democracy. And so they see the reaction of the right wing, both in the media, in the Congress, as kind of a not only a coup against Pedro Castillo, but really an attack on the people of Peru themselves, the people who have been fighting for a different vision of a country, who want a different constitution, who want a different way to do politics in the country, and are seeing that the right wing, when this proposal is on the table, how they respond is with violence, is with repression, is with criminalization.
Your assignment is likely to go for a few more days. Zoe, how do you see, or anything in terms of events unfolding over the next few days? Any planned activity that you're expecting to see happen?
Well, there's still mobilizations going on across the country, daily mobilizations, strikes, vigils in memory of the victims, as well in the political area. There's some developments happening today. There's going to be a new premier that's going to be announced and designated. There was also an announcement late last night by the military jurisdiction, the military kind of judicial body. Dina Boluarte, the leader of the coup government, she had said that all of the crimes committed by the military and the police forces against protesters would be judged by the military court and not by ordinary justice. This, of course, provoked a lot of anger. And actually, last night, the military court announced that they would not be judging these crimes, that this pertains to ordinary justice. So there's a lot of different kind of fissures that we can see developing within the bourgeoisie, within the ruling class, the response to this, to the repression that has been unleashed on protesters. Today, there's a commission from the Inter-American Human Rights Commission arrived to Peru to investigate the different killings of protesters. They're going to be in the country for the next 3 days, going to the different places where there have been large mobilizations, speaking to family members, speaking to victims. And they're going to be creating a report. I think this will have a lot of impact on the political situation, just due to the pressure that the government is facing because of this repression. But however, despite all of these developments, Dina Boluarte has been on several mainstream media outlets, on TV, and has reaffirmed that she's not going to step down. This is one of the main demands of people on the streets, that she step down, that Congress be dissolved, that Pedro Castillo be released, that he be restituted as constitutional president of the country. This demand remains on the table, but I think in the next couple of days, there's really going to be a lot of developments regarding the victims of the violent repression. Lots of national mobilizations, and I think a lot of different groups are going to be kind of charting out their plan for resisting what many different organizations are calling a dictatorial government, a coup government, a government that is violating the rule of law. So we'll definitely be following all of those developments, going out to the protests, speaking to people who are on the streets, and hearing about many people also, to mention, they're coming from outside of the city, coming to Lima to put pressure on the different bodies of government. Have conviction that it's necessary to reverse this coup, that there be justice for their brothers and sisters who have been killed. So we'll be speaking to them and continuing to give updates on this.
Thanks very much. Good to catch you when we could, and we'll catch you again soon, hopefully in a couple of days for more on that story.
Thanks so much for having me.
And our second and final story for the show today, the World Health Organization's scientists and advisors have shifted their stance on calling an end to the global COVID-19 pandemic, following a significant uptake in the number of cases in China. The world's most populous nation and second biggest economy managed to keep infections and deaths relatively low thanks to a hard zero-COVID policy that has only been revised over the past week or so. For a sense of what's happening in China and how other big countries such as India, the US and Brazil, who are all hit extremely hard by the virus, are preparing to respond, we're joined in studio by NewsClick Editor-in-Chief Prabir Purkayastha. Prabir, good to have you back in the Daily Debrief studios. We're talking about, over the past couple of days, news reports, press conferences, etc. happening, where China is essentially telling the medical community and the wider world that they are paying much closer attention to the possibility of new variants of the COVID-19 virus, and also, of course, numbers as their infections are perhaps on the increase. What is your reading of the situation? You've been following it in some detail with Satyajit Rath as well from the time COVID-19 broke out.
The first and most important issue for the public, at least, is the fact that the COVID-19 norms, which were really quarantine, trying to have a zero COVID policy, that's been relaxed. Okay, that's been not given up, but relaxed considerably. That relaxation announcement came a week before the really large outbreaks and the protests that took place, though the world has seen it as if it's a response to that.
Right.
So we have to think about first what really happened in China, because China is a big outlier. In the world, its number of deaths have been very few compared to what all other countries have had. It's about 5,000, 5,500. And therefore, that number compared to the numbers in the United States and India, for example, are shockingly low. That compared to China, we would be shockingly high.
Yeah.
So they were actually an outlier in the whole world in the way they have handled COVID-19, and now having relaxed it, and also the Omicron variant had taken root in China, in spite of the quarantine, in spite of the lockdowns and so on. Therefore, we have to now see what happens. Yes, there is no question, as COVID norms are relaxed, given what other countries have seen, even with the quarantine China's quarantines, which are much more, and lockdowns, which are much more strict, it does appear that we are going to see high numbers appearing in China. So that's one part of it.
Right.
And there is a whole bunch of other things which have happened, which is they were being damned for having zero COVID policy. Now they're being damned for having lifted it, and also being said, oh, huge numbers are dying and so on, without reference to the fact that huge numbers have died in all countries. And also they avoided the Delta variant, the Omicron variant, the numbers are higher, transmissibility is higher, but at the end of it, the number of deaths per 1,000 infected or 100,000 infected are relatively maybe 1/4, 1/3 that of Delta. So this is one part of it. And I think we'll have to see what the COVID-19 policies, the change of these policies, what it means. There is also some kind of campaign that they have relaxed what is a COVID-19 death in China, making it much more restrictive, changing the definition. I just did a quick look what the United States identified as a COVID death and what China has said this is what they would consider as a COVID death. And the definitions don't seem to be different. So it's essentially that if somebody dies with COVID infection and no other cause, or with directly attributable to COVID, which is pneumonia and so on, then it's a COVID death. But if you have a heart attack and come to the hospital and you contract COVID, which a lot of the Indian patients also did at one point of time, then those are not considered as COVID deaths. In fact, in Omicron times, a lot of the people who died with COVID but did not die of COVID because they had gone to the hospital for other reasons.
Right.
So these are all the complexities of the case. Taking a step back, because now we see again the numbers rising in India as well, and there are again talks about reinstalling some of the not lockdowns, but some of the COVID precautions.
The protocols, the safeguards.
Protocols, all of that. Those are now seem to be also being imposed. And this is something which we have been seeing as a recurring phenomena throughout this COVID period, a completely new disease, a completely new set of things therefore to confront. RT-PCR tests, very good. It was done really very quickly. But the point is that beyond that, and vaccines, which is an old knowledge that we have, vaccines against infectious diseases, we really haven't succeeded too much in any medicine or any new approach to COVID-19. Yes, there have been MABs, monoclonal antibodies, but as you know, Omicron, they were not effective.
Right.
So given all of it, yes, an unknown still for humanity, but it does seem at least the Omicron variety is relatively, in terms of number of deaths per 100,000, relatively 1/3 to 1/4 that of what we saw earlier in Delta. So if you have to relax the COVID protocols, this is a good time to do it.
Now is the time to do it.
Okay.
Right.
And the point is that how long can you go on with the same COVID protocols? But China's case is important because they took 3 years to prepare for this. And I think that's a huge success they have had, being able to keep it at bay for 3 years.
Yeah.
And now that they have at least an improved health infrastructure, they know the disease much better, they know what to do and what not to do. All these things probably would help to keep their overall numbers of excess mortality, which is the only count we have of COVID-19 deaths in the larger sense, that the excess deaths might not be as high as we have seen in India or in the United States. The two really big countries with big number of deaths. And of course we can add Brazil to that as well. Again, another big country and big number of deaths. But China's population and India's population are same. If the kind of Delta wave that we saw had taken place in China, the numbers of deaths and the hit to the economy would have probably been much greater.
Right. Very quickly, if you can, Prabir, the international response, you were mentioning big countries like India and the US and Brazil. How are they responding to the scenario, and are there sort of some efforts being made to at least?
Here is the issue, that the US, India and Brazil actually react all differently. United States particularly, there is this very strong sense of identity. I must have the right to keep guns. A lot of, even including SLRs, which you can fire 30 shots with one pull of a trigger kind of thing, those kind of weapons, and I should have right to not wear masks and infect others. Now that's a policy which no other country actually believes in. The population doesn't seem to, shall we say, no strong group of people seem to believe in this. So we are willing, if the state tells us to mask, well, number of people will, and if there is a step taken that there will be policing of that and it will be fine, then most people will not pull out a gun, okay, unlike the United States. So I think the situations are very different, though they are both called democracies, electoral democracies, etc., etc. The response is different, and Brazil lies in between the United States and India. We have Bolsonaro, of course, the Trump-like figure, but nevertheless, Brazil has never gone to this extent of pulling out their guns for protecting the right not to mask. So these are the differences. So I think each country is going to behave differently. The health systems know much more about it than they did earlier. So that is one strong point in favor of the future.
Yeah.
But there is this mistaken belief that COVID is going to get more mellowed with age. Now that is not true. This belief that we slowly tame the
dilute
disease,
it.
The virus gets tamed, is a mistake. That there is no evidence to support this. It can go this way or that way.
the other.
The only thing that we do know that the transmissibility, any organism, its evolutionary path is to try and have more copies of itself. Now, it can have it by having it multiply inside your body more and more, causing therefore severe illness. Or it can do it by transmitting among the larger population. So transmissibility and multiplying itself within the body are both viable evolutionary strategies for itself. The organism as a whole, as a collective, has no intelligence. It's the individual organisms which replicate. And therefore both the strategies exist, and we have seen both of this happening. So I think we have to see that 3 years in the life of an organism, evolution life of an organism, for their 3 would mean a couple of 100 years or more for us, probably even more, because you're talking of number of generations.
Right.
So given that, yes, this is not as short a period as it might appear, but it's not too long a period either. So given that, we have to wait and watch. And all that we can do is have tripwires by which we can install local lockdowns and local procedures, strengthen the public health system, including the detection and the hospitals, so that when you are serious, you are in a hospital, you can then be attended to with the COVID protocol. So that's strengthening the public health system. Unfortunately, the third is what is weakened in the COVID, not strengthened. And we have to see how China, for instance, copes up with it.
All right. Thanks very much for that update, Praveen. That's a wrap for this episode of the show. As always, we invite you to head to our website, peoplesdispatch.org, for more details on these stories and all of the other work we do. Also, don't forget to give us a follow on the social media platform of your choice if you haven't done it already. We'll be back with another episode, same time, same place tomorrow. Until then, stay safe. Goodbye.